Federal government has inaugurated brachytherapy machines in 5 tertiary hospitals to aid the treatment of cancer through radiotherapy. At the commissioning in Abuja, the Minister of Health, Dr. Osage Ehanire, said that the Federal Ministry of Health has continued to improve access to cancer care services, especially in diagnosis, chemotherapy, and radiotherapy services. The news agency of Nigeria, NAN, reports that brachytherapy is a type of internal radiation that uses radiation to destroy cancer cells and shrink tumors.
We are currently adding radiotherapy services to some hospitals in the country with the installation, training, and the functional brachytherapy machines at the National Hospital Abuja, University of Nigeria Teaching Hospital Enugu, University of Benin Teaching Hospital Benin, University College Hospital Ibadan, and the Ahmadu Bello University in Zaria. Such a facility also has been set up at the Usman Danfodio Teaching Hospital in Sokoto, but it is yet to be commissioned. On this 2023 World Cancer Day, I shall commission these brachytherapy machines in these hospitals I've mentioned, and that one in Sokoto, as I said, will be commissioned at a later date. I shall be presenting memos to Council for the procurement and installation and training for radiotherapy and nuclear medicine facilities at these benefiting institutions, which will begin implementation very soon, or rather which will begin the procurement processes very soon.
Ehanire added that the approval also extends to provision of nuclear medicine facilities in Lagos University Teaching Hospital, Lagos, and FTH Katsina. On the occasion of World Cancer Day, commemorated on February 4 every year, Ehanire said it was to draw global attention to one of the world's dreaded diseases.
To this end, the human papillomavirus vaccine is being introduced into the National Program on Immunization as we scale up secondary cancer prevention interventions being funded by UNITAID through the Clinton Health Access Initiative. The program has started in Lagos, Rivers, and Kaduna states, and is now scaled up to involve Niger, Kebbi, Ondo, and Ekiti states.
On the equipment, Mr. Benjamin Ubiri said it could be used separately without surgery, and the results will be the same as when a patient undergoes surgery.
Even though it's a radiation therapy, and if you use it in combination with the therapy, you get a super result. If you also use it alone, you can use it separately. And we have it successfully installed in 6 tertiary hospitals in 6 geopolitical zones, and we are open to partnership to other people. It will change drastically the way cancer is perceived and cancer treatments are done.
In a goodwill message, the President, Nigerian Cancer Society, NCS, Dr. Adamu Umar, represented by Dr. Omonisi Abidemi, commended the contributions of the federal government on the prevention and control of cancer in Nigeria through various lofty initiatives.
We are confident, that management of cancer, patients in this country will actually improve. Above all, we want to actually engage in research in our country, because we know that cancer management and treatment, there is genetic diversity in cancer prevention. That means that some of those drugs, academic breakthroughs and drug breakthroughs in Western countries used on the white may not probably work on the black, because we have different genetic diversity. So with this center, the center can stimulate breakthrough research in the country, particularly not only limited to cancer, also in other areas.
The general manager, Roche Nigeria, Ladi Hamid, said that the setting up of the brachytherapy equipment was a laudable achievement.
This is a laudable achievement, and we celebrate its arrival. We also want to support this celebration with a call for additional programs to improve accuracy of diagnosis, provide access to health insurance, and treatments to positively impact cancer survivorship. All of this works together to complete the continuum of patient care and ensure Nigerian patients get the same standard of care as patients in any developed